basically, a person who has dissociative identity disorder has a multiple identity, multiple personalities. And it just stems from, things like schizophrenia, PTSD. It's things that, start off with like that, with just traumatic things that happened with your upbringing, and just so many, traumatic experiences that just build up, and just the way, they're, just a bunch of toxic and, just unfortunate events that people go through. So this is something that's real. And basically, a person that's got dissociative identity disorder have many alters. They're called alters. And every alter has a name, and they're basically just a individual person, So it's very intriguing. I know I got my phone here just because there's so much things that are to it, but there's really no such thing as like a treatment for it. It's really just like therapy. And once you're diagnosed with it, they've got that, on record. So this is what this video is kind of about. You guys have seen the topics we've been covering before when we speak about things like gangstalking, TIs. So the minute that you get into that, this is when the rabbit hole goes super deep. And, categorization tactics is what I like to call it, will be brought out. And this is where all these medical terms like schizophrenia, PTSD, and these are real things. So we're not here saying that that's not real. No, those are very real. What we're trying to say here is that, no one here is diagnosed with it, Personally, this video isn't supposed to be about me, but you may notice different videos. I'm in different moods and different behaviors. And so, you can understand where someone who doesn't understand, the concept, such as something like gangstalking, of course, they're just going to externally see these words that are brought out by, someone who's been an expert. Because obviously here, I'm not a doctor. So this is why when you're someone who's speaking on things like this, the majority of the world obviously isn't going to take you seriously. But you really just, it's one of those things, where you just kind of need to try not to care about the messenger, but just listen to the message type thing, and that's the part where it's kind of hard to get them to understand that, So it's just a wide range of just changing behaviors and things, and I'll speak about this later, but this relationship I was in, we understood each other really well, and it really is real. Dissociative identity disorder is a real thing. So if for those of you who haven't heard of it, I know some of you have, there's people who speak about it a lot on TikTok. I'm not really on that app, but you could check it out on that. And yeah, it's a thing where they kind of switch. So I'll speak on this later because, I want to kind of tie all four of these in, but I can completely understand where someone with DID, really needs to be cared for in like a certain way. And it's really not their fault. It's not their fault that they had to experience and go through traumatic, events that they couldn't really get handled correctly. So, sometimes they may self-reflect that onto other people when even a lot of us have been in real damaged situations, and even when you're someone who's in a relationship with someone who's got DID, you need to understand how your behavior and what your energy and what you're saying, and if you say something damaging, you need to understand and be wise enough to know, well, this person has a real actual mental health disability. It's real. But we'll speak on that later. Schizophrenia is something, a word that we've been hearing a lot. And here it says that it's a disorder that affects a person's ability to think, feel, and behave clearly. Hallucinations, delusions, confused thinking, and behavior. So, I've never went to a doctor really to say that, I've had many traumatic experiences, but I'm actually not diagnosed with PTSD. I'm not diagnosed with schizophrenia. I don't really know how, like, those of you who know someone who's diagnosed or are diagnosed, did someone get recommended, or were you the one who kind of went there because of because of experiences that was going on in your life, So I think it's just one of those things where sometimes someone may end up creating their own mental disorder that they may have that just isn't on record because they didn't get treated for it. And self-medicating is one of these things we get into when, I guess, we speak on people who are being deemed schizophrenic even though they haven't been diagnosed for it. Other than that, I can't see how you can just look at someone and just use whatever external features they're using to say they're schizophrenic unless they're physically acting that out. I think I never really knew what schizophrenia was. I thought it was just really someone who needs self-medication for their behavior. But maybe that's something that just causes their delusion, though. It's something that kind of confuses me, because you think that if a person who has schizophrenia is taking a drug for that, then it wouldn't make them act out as schizophrenic. So maybe I'm not catching something with that one. Because, like I said before, this is just something that I'm researching. This is something that we're just looking at on Google. But here, we don't have, we haven't been diagnosed for any of that. And maybe I'm just someone who's kind of hard to catch someone who may have that. Or, we're all not good at seeing a side of us that other people may, there may be a side of me, when it comes to just uploading these where you guys see something and I don't see it. But then again, we just don't get that deep in worrying about the way we look and stuff, We're just trying to just kind of get our point across and just keep it moving, But saying, it's a mental disorder, disruptions in thoughts, processes, perceptions, and emotional responses and social interactions. So I guess when you're someone, there's times when, I'm speaking and, there'll be times where I get caught off guard and I don't catch myself, like, not staying on point with what I'm speaking about. Like, I'll be all over the place, so that may be something, but then again, in social interactions. Let me see here. Can you live a normal life with schizophrenia? Most patients who go through treatment find the right medications, continue self-care management. So let's look into PTSD right now. And then obviously, you can't type in anything about being a TI, because you guys know the rabbit hole is way deeper with that one than the other three. The TI one is actually, you're going to see reverse psychology when you type it in, and they're going to make it seem like it's a phenomenon. But yet, it's actually not, because the ones who are doing it to you are the ones dropping that info. So it gets way deeper with that. But the PTSD, because you're the one who's being experimented on for them to actually categorize you in PTSD, DID, or schizophrenia. But then again, like I told you guys, when it comes to the TI thing, obviously there ain't no doctor for that because it just gets too delusional. So PTSD is a disorder in which a person has difficulty recovering after experiencing or witnessing an event. So yeah, it'd be most likely to say here that PTSD is more relatable than the schizophrenia one, if someone were to try to categorize someone here, because of just how many events we went through. You get what I'm saying? So what's the main motive of this video here, though, guys, to kind of, drop a summary? The main motive of this video is that being on record saying that you have a record of you're schizophrenic, or saying you have a record of PTSD or whatever, you've been categorized, really. You know, some of you who are saying you're TIs, you know, and you may have a doctor. This is where I'm going to differentiate myself from you guys, where I'm not in a category of people, because I'm yet to do that. Now, could we go get treatment? Would it be better to benefit ourselves doing that? You don't know, actually. We don't know, actually. That's what we're trying to say here. I opinionally believe that it's more negative to be categorized in PTSD, schizophrenia, DID, rather than be a non-investigative, because then that way there's nothing to be, you can't categorize this person or try to put them in a box or try to say anything. It's better that route. It's better to be the free route, if you want to look at it that way, because either way they're gonna be you being guinea pigged anyway, experimented on the minute that you're in these categories. And then they already have it set up for the amount that you need to take. Yet we all have a different, you know, body mass index, BMI, and all of that when it comes to these prescriptions and stuff that they be given to people, you know. It says people who suffer from PTSD, intensely stressful situations, sexual abuse, natural disaster, yeah. You know, and there's going to be, you know, triggering things. So what's PTSD recover treatments? Psychotherapy, I don't know what kind of medication you would take. Psychotherapy, they're saying, though. I know there's people who take, like, you know, relaxers. I think I ran into someone who was in the army, and he took like relaxers and stuff like that, you know, because he did you know, he did combat in the military, you know. And then obviously TIs, they're the ones who are, you're pretty much shadowed, you get what I'm saying? And they're trying to kind of put you in that box when it comes to, you know, for those of you who are, you know, TIs, but you've been to the mental hospital, or you've been categorized already. I mean, if you're taking medications for something and a doctor already categorized you, I mean, you're kind of categorized. I mean, even though, I mean, don't get me wrong, you're still being harassed and, you know, annoyed and gang stalked and all this stuff, but, you know, people get too lost in that word. People get too lost in that word and think it's not what you guys like think. You know, it's not what the people who look at it as spooky think. You guys know that. You get what I'm saying? But yeah, this is really just about trauma and stuff, and how, you know, when it comes to things like that, it's really self-reflection, and the people you're with is really going to impact and influence these people who have disorders. So it's not to say that being categorized is a bad thing. That's not what we're saying here. It's a good thing. It's a good thing to know if someone has a disorder, so that way you know the correct way, especially if you're choosing to, especially if you love this person, especially if you're choosing to be around this person. There's no way, if something goes wrong, you can be the one who tries to blame that person because you knew. You get what I'm saying? So, you know, when it comes to these are real touchy topics to speak on, you know, because it's not this person's fault. This person who got diagnosed, and, you know, they went through a tough time, and, you know, they still may be battling things, is not their fault. You know, we got doctors for a reason. We got, you know, medication and treatment for a reason. You know, so this video was kind of just to kind of tie the all four together, you know, where You know, where being a TI is, that's all the just, you know, underground, like, you know, illegal experimentation things going on, where the minute that you choose to can't not, you know, if you're someone who's really going through this and you can't say you can't take it anymore, and then it reaches the point where you gotta go to the doctor or you go to the hospital, and now you get signed and treated, you've then been categorized. That's kind of my take on it. So this is why here on this channel we haven't gone, we're not going to get you know, categorized. We're not going, because I view it, depending on who you are, this is just my take, as it kind of just being detrimental to you. I believe that you kind of get, you are following a system now. That's the thing with the TIs. You're not in a system. You're doing it on your own. You know, you're finding you within, kind of, where everyone else, they followed someone else's program and they're taking this amount as what they've been told, and everyone is that they're in a system, the medication pharmaceutical system. Kind of like if you're a TI, maybe I'm not, you know, some of you may be looking at it different. You're not really in that, though. Maybe I could be wrong, you know, but you're not, for the most part, you haven't been categorized. You're non-investigative type thing. You get what I'm saying? Because you never chose to do that. But anyway, you know, I kind of rambled on there. You know, I might add a little more to that later, but I'm gonna go ahead and, you know, end the vid there. I kind of just wanted to just speak my mind on that a bit. So I appreciate you guys for checking out the vid.